Hello, my name is Dr. Randall Roenigk. I'm a professor of dermatology at the Mayo Clinic in Rochester, Minnesota, and I'm in the Division of Dermatologic Surgery. And I'd like to talk to you today about a relatively rare skin cancer called Dermatofibrosarcoma protuberans, or for short DFSP. Dermatofibrosarcoma protuberans is a rare cancer of the skin. It starts in the middle layer of the skin, the fibrous tissue of the skin, and grows very slowly. It usually looks like a scar, and patients often say, gee, I got this scar, but I don't really know where I got the scar from. I didn't get an injury there. And it's slowly getting bigger, and it usually takes several years to become a substantial size. Eventually the cancer can become invasive. It can go into the fat, into the muscle, and into the chest wall. So it needs to be treated surgically, but it's not at all uncommon that it goes undiagnosed for a long time. Dermatofibrosarcoma protuberans is a rare tumor. It's probably diagnosed no more than 100 or 200 times per year in the country. So very few institutions have large experience with it. We have about the largest experience with this tumor in the country. The tumor typically occurs in younger folks, and it typically occurs in areas that are not sun exposed. So when people think of skin cancer, they usually think of the sun. They usually think of people that are a little older. Well, this cancer goes against some of those rules. It almost always occurs on the trunk, although it can occur in any part of the body. And as I said before, it starts growing slowly and looks just like a scar that seems innocuous and doesn't really have much in the way of symptoms, except maybe it itches a little bit. It wouldn't be a surprise if the doctor didn't make the diagnosis initially, especially if you saw a physician who really wasn't an expert in skin problems. It would look like an innocuous lesion. The way to make the diagnosis is to do biopsy. So you need to have a sample of the tumor removed and submit it to a dermatopathologist, and the dermatopathologist would make the diagnosis based on what he or she saw under the microscope. The cancer is invasive, as I said earlier. It goes in from the skin into the fat and into the muscle sometimes, and so it has roots. And sometimes the roots are hard to see with the naked eye. So the best treatment for this cancer is surgery, and the best surgical treatment is a procedure known as Mohs micrographic surgery. Mohs is the name of a doctor who described a particular technique of checking the edges under the microscope so that we know while we're doing the surgery if the cancer is clear. If the cancer margins are not clear, we know where they're not clear, and we keep going and taking additional tissue until we know the tumor is out. This procedure usually takes a day. Sometimes it takes longer. Sometimes we do special stains while we do the excision, so occasionally it can require extensive surgery or maybe a hospital stay, but that's rare. And then once we finish excising the tumor, we have a defect that we need to repair, so that has to be fixed surgically, usually by some kind of suturing technique or maybe a flap or a graft. The cure rates after excision of these tumors by Mohs micrographic surgery are essentially 100%, or very close to 100%. If the margins are not completely removed, then the tumor can recur, and occasionally they do recur if the tumor is not completely excised. There are some cases where the tumor has recurred years later and can invade into deeper tissues. So if you were a patient, how would you know you had a DFSP? In reality, you would probably not suspect a skin cancer, but you'd probably see a lesion on your skin, and the lesion would slowly grow. It might itch a little bit, but it wouldn't bleed. It would be very subtle, but you'd notice that it was getting bigger over time, over 6, 12, 18 months. and it wasn't going away. So you might suspect it's a scar, you might suspect it's a cyst, but you would probably not be seriously concerned because this is such a slow-growing tumor. Most people know that skin cancer in general is caused by sun exposure and other carcinogens. There are also some genetic predispositions to skin cancer. But for dermatofibrosarcoma protuberans, the cause is an enigma. We don't really know what causes this problem. It probably is something genetic, but it's such a rare tumor that no one's spent enough time or energy trying to figure out what the cause is. But we don't think it's related to sun exposure, especially since most of these occur where the skin is not usually exposed to sunshine. It's very common for people with skin cancer to get additional skin cancers. So if you had a common type of skin cancer, such as basal cell carcinoma, squamous cell carcinoma, or melanoma, it's relatively common that those folks would get another skin cancer later in life. But dermatofibrosarcoma protuberans is so rare that it's really unheard of that you would get another dermatofibrosarcoma protuberans if you had one diagnosed earlier in life. It's possible that tumor could recur, but it's not likely you would get another DFSP. It's also not likely that DFSP predisposes you to the development of other skin cancers. Again, there's not enough patients with this tumor to say with certainty, but in all likelihood, someone that has a DFSP is not more likely to get a basal cell cancer or a melanoma.